I'm pleased to have Ted McCann, Assistant to the Speaker for Policy from the House of Representatives, Bob Greenstein, founder and president of Center on Budget and Policy Priorities, and Bob Dorff from AEI Next Door. And this morning, and now we're going to talk about moving away from the academics and talking about more about the practical issues associated with implementation. And I want to sort of start, again, sort of big picture. We spent the whole morning talking about the evidence and academic studies and making sure the studies are done well and are identified about the effects of policies. And, you know, and this would have been a reasonable question, I think, a year ago and 2 years ago. I think we feel like it maybe is an even more important question now, is like, so does evidence matter to the political process? You know, do these studies have an effect? And if so, like, how? And I'm going to take all of your.
I think it matters a lot. I think that in my experience in New York and in New York State, New York City, we paid attention to evidence, we paid attention to outcomes, and it had an effect on how you do your debate. I do think you have to be careful about overstating the evidence, and you can't oversell. And I think you also have to know your audience. I think that when looking at this sort of data about investments in human capital, I think the best finding is concerns Medicaid, maybe food stamp behind that. Not so sure the finding is so strong in cash. And I think that when you go in and talk to people who have particular viewpoint, and here I'm going to talk about my friends Republicans, they're going to want to hear about employment effects, and they're not going to want it to be dismissed as unimportant. It really matters, and they're going to want to hear the truth about that. And they're also going to want to hear the extent to which these necessity of investing in human capital is driven by an absence of another parent, for instance, or the issue of single parenthood. You can't just write a series of papers and make a statement about investing in human capital for young children and only talk about poverty and race and not also talk about single parents. So I do think it matters a lot. I think the speaker in his Better Way proposal that was referenced mentioned evidence. Certainly the hottest Republican election to some people in town was the election of Todd Young in Indiana. He was an evidence guy, pay-for-performance guy. So I think people that want to start with the premise that in the new world we live in now, evidence doesn't matter, certainly aren't helping their case.
What's your take?
Well, if I didn't think evidence mattered at all, I mean, none of us up here would be doing what we do. But having said that, I think my take is a lot less sanguine than Robert's. I think evidence can matter a lot when decisions are being made in a non-politically polarized atmosphere. But when an issue has a lot of politics around it, you can find members simultaneously talking about evidence basing and then in the same statement or the same document making statements that are actually contrary to the evidence. A couple examples of things that bother me now. We continue to have members of Congress and others say, as though this was based on evidence, that anti-poverty programs are a failure because the poverty rate is the same today as it was in the 60s, when every reputable analyst knows that comparison is based on the official poverty measure that doesn't count hardly any of the programs that have expanded because they're generally non-cash, and that there's broad agreement among analysts that poverty measures, particularly when you're doing historical comparisons, should count the non-cash benefits, and then when you do, there's been a big reduction in poverty. We've had hearings on the Hill. I was in one where there were 2 Republican and 1 Democratic witnesses, and the witnesses echoed each other that if you're doing historical comparisons, you can't use the official measure or you will get misleading results. And members who were in the room and heard this agreement within days were repeating the line, everything failed, the poverty rate didn't go down. One more example. If you look at a lot of the discussions on the Hill, there was an earlier panel, I think it was Greg and Kristen were talking about how much of policy discussions were in the context of perceived labor supply, labor market effects. And there's a particular line you hear over and over again in policy discussions that low-income people in large numbers face 80% marginal tax rates and are often worse off if they take a job. We have a CBO study that came out a year and a half ago that says the median marginal tax rate is 14% on people below half poverty, 23% between half and 1 times the poverty line, 34% between 1 and 1.5 times the poverty line. And we did an extensive analysis to find how do you get to 80%? There are people who face 80% rates, but you have to be in a narrow income range and get an atypical combination of benefits. So it turns out that about 3% of single-parent families with kids can be subject to something in the 80% range. Doesn't matter, the data's out there, it keeps being repeated as though this is the norm. So I think where we run into challenges, or where the data are the evidence, don't support an ideologically held position or aren't helpful in a polarized political fight. And I think our big challenge is how do we bring evidence basing even into those kinds of debates?
So do you have a response to?
Well, I mean, I guess I'll go and talk a bit about evidence more broadly in the political process. I think actually we do use evidence fairly regularly in the political process. I think you've seen Speaker and then Senator Murray move forward with the Commission on Evidence-Based Policy. You mentioned Senator Young talking about pay for success. And then not only that, but whenever I've been in the room trying to figure out how to move policies forward, even when it's Republican, Democrat negotiating things out, typically there's a conversation about what the correct policy is. Now there's political conversations going on at the same time, but it's not a conversation devoid of what we think the best policy is. It is a conversation based on a political reality and then combined with sort of what the best policy going forward we think should be jointly. And a lot of that is getting agreement on what the evidence shows. In a lot of controversial issues, the evidence is mixed, right? And folks, you can't really come down on one side or the other side. And folks retreat to their priors and end up, arguing from probably a more political point of view. But, again, that's just part of living in a messy world, I think. So.
Go ahead.
And I would just say that just on the first example that Bob gave, most of the time when I'm in the room and that statement is made, it's always with the proviso that we have relieved material hardship when properly measured with poverty, but we haven't yet achieved a goal where people are earning their own ability to rise above poverty without the transfer payments. And I think that isn't just a political statement. I think there are Americans who care about having people get out of poverty so that they, at the end of the day, don't need EITC or food stamps or the value of public health insurance to provide the difference between what they earn or make on their own and the poverty line. So I acknowledge that political statement, but we both have, on both sides, egregious behavior by politicians who sometimes say things that aren't quite right. But that one is a little more complicated because people do aspire to having the poverty measure be achieved without transfer payments.
I have to disagree. I mean, Robert, what you just said is fine. But in most public debates, you look at various members of Congress and others on Sunday talk shows and the like, they do not express it more often than not in the nuanced way you just mentioned. It is used as an emblem and as evidence that anti-poverty programs have failed and we should radically change them. That is the most common rhetoric. The war on poverty failed. It didn't move the needle, a very common statement. The shows we're doing things wrong and the current things don't work.
Except those same people that say that welfare reform was a success.
I'm not getting into the welfare. Welfare. Well, the welfare reform thing being discussed is very. I think we can agree the evidence. I
think we could probably argue that different poverty measures show different things.
Yes.
We can agree with that. The point is,
the more accurate poverty measure to use would be a consumption-based poverty measure, which we do not have at the moment. So. Anyway, these things.
I also heard you sort of say, though, what people say in public and what they say in the back room is kind of different. And, I sort of worry about the disservice done when things, you might say, like, we know the facts, but, then we're playing politics all the time. So that's something. Is there anything that academics or think tanks could do better to try to get more agreement where the evidence really, like, everybody sort of agrees on the basic facts.
There's another problem here. I'm not sure exactly what think tanks should do about it. So we all know, I think everyone on the panel would agree, that on a lot of complicated issues, I'm getting away from poverty measurement into research on impacts. On a lot of issues, there are multiple studies, and they sometimes go in different directions. If there are 5 studies and 4 go in one direction and 1 goes in the other, it is not uncommon in this town for people for whom the one that goes in their direction, they cite only that one and they don't tell you the other 4 exist. And then that, hey, evidence-based, here's the study. And so I don't know how one achieves the following goal, but there ought to be a norm, increasingly common term these days, there ought to be a norm that when we're discussing an issue on which there's research and evidence, that if various pieces of research go in various directions, it's perfectly fine for someone to say why they think a given study or studies are the best ones, but you need to inform your audience of the studies that go the other way, and if you think they're wrong or not as solid, why you think that. But what should be viewed with suspicion is anytime there are multiple studies, if someone cherry picks one and doesn't tell you about the others, if they're quality studies that go in the other direction, to me, that's not evidence-basing.
I don't think you can argue with that. I think it's a good aspect to look at the full array of studies. I also think it's important to, when citing the studies, to be really clear about the findings and the margins between a finding that shows a significant impact and not. I think sometimes in town, people have a tendency to say the evidence suggests or the evidence shows or there's a lot of evidence that proves. And then when you look beneath that and you find that really the difference in the outcome wasn't that great, and it was, as Bob says, there may be a couple other studies that showed something different. And I think that when that happens, at least in my limited experience here in town, when that credibility problem comes into effect, it really undermines the whole finding. And you don't want to do that. You want to be clear about the caveats and the extent to which whatever intervention, especially in poverty policy, had an impact, but it maybe wasn't quite as big as you want to pretend it was. I also would say one other thing, and that is that we can't underestimate the prevailing economic forces at work in the country that are sometimes more important or appear to be more important, especially in poverty. In that sometimes you had a question in something you said to us, you said, well, why don't everybody talk about this when all they want to talk about is scoring, dynamic scoring? Mm-hmm. And I said, because a thought to me was because people are worried about the overall economy as much as they are worried about a particular intervention in poverty. And I just think that has to be considered.
So let's move on from that a little bit, but it brings me to the next question, which is the thing that we try to talk about today was to sort of bring bunches of different kinds of policies together, because we think really these are policies that are actually have the potential to be investments. We all want to raise future growth. We're worried about productivity. We're worried about supporting Medicare and Social Security. So things that sort of will raise future growth, and with interest rates so low, it's a good time to do investments. So we're like really focused on like what's consumption and what's investment, and how much can you make the case. Is that something that politicians actually care about? What happens if 10, 20 years down the road from something? Or really is it you've got to make the case that it's jobs, or it's, is it all about labor market stuff? Why don't you start?
I think politicians care a lot about that. I mean, we just passed 21st Century Cures, which is almost entirely about sort of seeing, down the road benefits from reducing diseases. So I think, when they're talking about the ACA, there's a lot of conversation about prevention. I think that's something that politicians consider fairly closely. Now, you do have the scoring rules that don't really allow you to capture any of those savings, so it makes it more difficult to include them. But
so, going back to the evidence a little bit.
Can we stick on the growth for a moment?
Yeah, we can stick on growth.
So, look, if you're a politician, you can be in either party, and you're favoring a policy. It could be a tax policy, it could be a spending policy. More often than not, you will claim that your proposal will promote growth. Doesn't mean it necessarily will, but these claims are so common. I would also argue that the standards that are used for claiming growth effects are not equal on the spending and the tax side. Almost any tax cut that anybody favors, can be in either party, is often claimed as producing growth. In most cases, claims well beyond the evidence. What's interesting on the social program side, your paper, I think, does a great job of summarizing and synthesizing this. I find that even after the last 5 to 10 years of research, which you've captured so well, if I'm on Capitol Hill, and I'm not talking about Republicans versus Democrats here, it's pretty much the case with all of them, there is a real lack of knowledge of the research showing some of the long-term positive effects on kids, poor kids, of certain kinds of program interventions, as you discussed in your paper. Whereas among both parties, there are kind of assumptions, often fairly evidence-free, or the evidence may come from a K Street lobbying firm that's producing data to serve its clients, that whatever is the tax cut or tax break du jour will have all these terrific effects on growth. I'd love to see somewhat more attention on the spending side, but for both of them, equally rigorous standards for what we know about growth effects. I think we're a long way from that right now.
So is there a role for CBO here, for example, to be evaluating policies as sort of a standard part of its toolkit, not just the cost and the scoring, but sort of saying, we think this is likely to be growth enhancing or not, or have a good impact on distribution, and to do that for, CBO and joint tax together for policies both on the tax side and on the spending side?
My view is it would be useful for CBO to do this on both sides as analysis, and that CBO should do it on neither side for scoring. I don't favor dynamic scoring for taxes. Depending on the model that you choose, you get wildly differing results. I suspect that 10 or 20 years from now, based on whatever data we have then, if one is doing dynamic scoring on taxes, we might be in whole different ballparks than we are today. But my view is we should get the best analysis we can of those effects on both taxes and spending, but I don't actually favor doing dynamic scoring on either side of the budget. I think it undercuts the solidity of the fiscal numbers.
Would it make a big difference, do you think, in terms of what kinds of policies were enacted, though, if there was some kind of score to it, or if there was some kind of standard analysis that they would do and people would look to?
Yeah, if you can find savings for a policy, then that makes a big difference.
But it's got to be within the window.
Yeah, it's got to be within the window generally. That's how we score.
So stuff that on young kids, happens 20 years down the road. There's no numbers way of really making it.
Well, if you can show that it's going to save money and show that it will be, overall net positive, then that's going to be a mark in its favor. But in terms of the actual political moving it, it's very, very helpful to have a negative after a policy, because then it can pay for some of the other things that we like to pay for, like to do, that have a positive after the, so.
Let's face it, that's the main reason we now have dynamic scoring on tax policies. It makes tax cuts easier to pass. You may think it's totally legitimate. I'm not saying in making this comment it is or it isn't. But the main political motivation for beginning to use it was to make tax cuts easier to pass.
One of the things that you talked about was sort of like, we shouldn't oversell, the research results. But, as Kristen mentioned, it's really, really difficult to get, solid, broad research. You have to wait 30, 40 years, 50 years to know that these things really, really matter. But, we get snippets. We get snippets by understanding, that the young, the fetal situation matters a lot. But, there are a lot of snippets that we piece together. Now, that's not the same as saying we have incredible evidence. But, at the same time, not doing policies, while they may be incredibly helpful because we haven't waited the 50 years to see, and then it'll be 50 years too late and it won't matter anymore. What should the bar be? Like, how should evidence play in, and how good does the evidence have to be for policy to be based on it?
I just say one of the big difficulties is if you create a government program, it's very difficult to shut it down, right? So you create a government program, it doesn't show evidence, it's going to continue. And I think that's one of the big issues that conservatives especially have, right? If we were going to look at something that shows promise, but we would know that if it didn't pan out, then we could turn it off or no longer continue the program. I think you probably see a lot more willingness to take risks in this area. But I think generally the thought is, well, if we do something, it doesn't work, it's never going to end, and the spigot will continue going on forever, and then we'll just sort of add additional programs in the future. So
are you weighing the probability that it will work against the probability that, sort of...
right, and yeah, I mean, there's sort of that general
there are ways to evaluate the level of rigorousness of an evaluation, and there are technical ways of determining when you have a good study that does a very randomly controlled experiment that shows stronger studies, and we know what those are. Mm-hmm. And when you have a good one, you want to go hard with it because you do want to appeal to the Congress's desire to make changes now that make life better for the future. What I'm worried about is when you have a close call or when the caveats inside the study are actually pretty serious and you don't explain those as you present the results. Then I think you undermine the entire exercise because there is a gotcha game here, and it's not helpful when people say, well, actually, you didn't explain the detail there, or you made it sound like the impact was really significant when it really wasn't. That's all. I mean, there's definitely a bar. I can't describe what it is, but what I would say is if you don't have it, don't say you do have it.
Oh, I think a couple of challenges here. Robert's point about, I certainly agree that particularly where findings are not statistically significant, people shouldn't be presenting them as real findings. By the same token, we all know that in the low-income area, if you have an intervention and let's say there's an improvement for kids or employment, whatever, I'm making up 10 percentage points. Well, the average person may say, that sounds very small. We know in the world of policy, that's actually a big effect. Right. So we also have to help people with that. I think one of the really tough things is what happens when we have social science research and policymakers and the rest of us, draw policy conclusions from it. And then as the years go by, we get more research that sometimes actually goes in the opposite directions. Again, 2 examples. For years, the research indicated a lack of lasting effects from Head Start. Now there's newer research that suggests long-term positive effects. The same was true on moving to opportunity. The original results looked disappointing in most respects. The Chetty Katz-Hendren study has very striking and important positive effects for families with kids under 13 who use the vouchers to move to low-poverty neighborhoods. In the area of welfare reform, the academic studies through about 2004 and 2005 were a lot more positive than the more recent academic studies. And I think the political system has some difficulty. It's enough to get people to use studies in the first place. And when they start using them and get used to it, and a new set of studies come along that really go in a different direction, it can take years to get people to get their minds out of the earlier set of studies, and they assume that that's still where the evidence base is.
Although, on the other hand, you can have a series of studies that have showed limited impact of social interventions or a positive effect of welfare reform, and then when you get the one that goes against that, all of a sudden that becomes the most important study ever done. So you have to be careful both ways.
We're agreed. It has to be more than one study when there's lots of studies.
So let me ask a question about sort of what Sarah documented and whether or not there's basic agreement, sort of on both sides of the aisle, about the finding that where someone is born and the family circumstances in which they're born in has enormous impact on their eventual outcome, their earnings, their health, all these things. Is that a fact that everybody agrees on, or is there sort of basic disagreement on whether or not that's actually true or how true that is?
Yeah, I think everybody sort of agrees with that.
Everybody agrees with that?
Yeah, and absolutely. I think that, but yes.
And so the disagreement is about the remedies or what the federal role should be in the remedies?
Well, what I've experienced in observing the debate is that it's both about what are the characteristics of the household that lead to those disparities and whether we should talk about all of them which includes the absence of another parent or marriage, as well as race, income, neighborhood, community, or just a few of them. And as I mentioned earlier, I do think it's an important point for people that want to persuade, especially conservatives, about intervening in the lives of poor kids. It's important for them to start by including in why we need to do this the family issue. Because when you don't mention the family issue, you've immediately got a representative who's waiting for that. Where is that? Why haven't you mentioned that? I don't think anyone disagrees that it isn't part of it. Everyone agrees that. So just include it. So I think there's an agreement that, and I think Speaker Ryan speaks to that. He says in some of his remarks, he says it's not right that in America that the household in which you grow into determines the future of your livelihood. So there's an agreement on that. And then we have to talk about how and why we can persuade people on both sides to come together in interventions that reduce those disparities.
I think this can get complicated and challenging. So again, let's take the evidence synthesized in the paper on income effects on young kids. And the research indicating that particularly for certain kinds of interventions, SNAP, others, refundable tax credits, a variety of things, evidence that the added income early in childhood appears to be linked to increased educational attainment. In some studies, like Diane's in terms of girls who got food stamps early on, increased employment self-sufficiency in adulthood. We have a whole array of pretty strong studies showing that better educational attainment in school is linked to increased employment and earnings in adulthood. Okay, so we have a challenge. We're going to have a debate this year, among other things, on importing TANF-style work requirements into programs like Medicaid, SNAP, and housing programs. The evidence on TANF-style work requirements is presented in another forum in the same auditorium a few months ago by Bob Moffett of Johns Hopkins, one of the leading authorities, academic authorities on this in the country, is that the biggest effect, not the only effect of those work requirements, were lots of sanctions. Bob said they did larger effect in sanctioning and removing benefits than in increasing work. Okay, if you put these two pieces together, would this mean that large-scale sanctioning by reducing income and potentially increasing toxic stress among very poor young kids could reduce the degree of their employment and earnings in adulthood? And would the net effect over time from these work requirements on employment and earnings be positive or negative? The answer is, I think, we don't know. We don't have the kind of data to draw the conclusion of which side would be higher. But the question isn't even being asked. I really do think that the findings on the long-term effects on kids has barely penetrated into policy debates on Capitol Hill at this point. And a challenge for the years ahead is, can it become not the sole determining factor, but a factor amidst a bunch of other factors and other pieces of evidence as we have policy debates?
Yeah, I agree that it's new, and it is so new to the extent to which it's penetrated into Congress is understandable in my view, and but I also think that it's not part of the discussion. I think it will be part of the discussion, and I'm not sure that just the way Bob summarized the finding on sanctions and TANF was. I mean, I think the general perception is that the introduction of work expectations in AFDC through the TANF reform led to more work, less receipt of cash welfare, and less poverty.
Let's open up to the audience for questions. Our mics are coming around. Oh, right. George.
Hi. I don't know whether one would consider the Tax Foundation a provider of research or merely a reporter, but what they're doing is, I think, of extraordinary importance right now. Tax reform. They did a study on the Republican plan back in December, and all they did was report the numbers with this dynamic scoring and report the numbers without dynamic scoring. I know you were on joint tax. How does one get beyond that kind of nonsense, or is it just something we have to live with?
Dynamic scoring?
You know, the Tax Foundation is an example of my skepticism of dynamic scoring, because the Tax Foundation model, we've written a paper about this and other people, the Tax Foundation model rests on a series of assumptions, some of which are, shall we say, outside mainstream economics. And the dynamic scores they get are very different than those CBO Joint Tax gets and those in the Tax Policy Center analysis issued this fall. And the range of results under dynamic scoring are so enormous, and I think that's because, you know, while in concept, who could disagree, you want to know the economic effects, and if you could actually get good scores on it, you'd want to use those scores. In reality, it's hard to, in my view, to trust any particular dynamic scoring when so much depends on the assumptions underlying the particular model you elect to use to do the dynamic scoring.
Questions? Anybody? Over there. And tell us who you are, please.
I'm Mara Weinstein. My question is about using evidence and what all of your takes are, and the fact that there is a ton of evidence in the research community that goes unpublished, a lot with negative findings. And so when you have research presented to you in a world that really thrives on the Cliffs Notes or the Twitter version of the results, whose onus is it to dig deeper into that information? Is it the presenter or is it the decision maker? And how do you advise people to go about that?
Anybody?
Both.
Yeah, I'd say honestly, it's probably on the decision maker more than anybody. You know, when I was at Ways and Means, we spent a lot of time talking with folks in the academic community, but also folks that are on the ground to get a sense of, okay, does this academic finding make sense with what other folks are saying? And so you weigh all of that and try to come to the best possible conclusion. But, you know, I think the academic is trying to show a change and show something nice, and it's our job to make sure that it makes sense.
I think it also attests to the importance of institutions like the Congressional Budget Office, the Congressional Research Service. There are a number of, I know, CRS reports, I'm thinking of some in the tax area, but they are in the spending area as well, where they review various pieces of research. It's not a government agency, but this is another reason I find the Urban Brookings Tax Policy Center, I think, is a critically important institution. We need institutions that do high-quality work, that aren't politically motivated, and that people, regardless of their political viewpoint, hopefully can look to for help in sorting through a lot of complex data and numbers and helping them to evaluate an array of a blizzard often of information and sometimes numerous studies that go in different directions.
Great. Terrific. I think we're going to end it now. Thank you so very much for participating. Thank you.